Go.
Okay, so patient number 1 is Helen Grunwald. She's a 28-year-old female. She was formerly a gymnast and she exercises regularly.
Some of Helen's symptoms were pins and needle feelings in her hands and feet, which the parietal lobe is responsible for. She's very tired and weak, the brain stem. She had impaired vision, which is the occipital lobe. She was depressed, which is the frontal lobe. Unsteadiness, which is the cerebellum, and loss of balance, which is also the cerebellum. And all of these symptoms came and go. We diagnosed Helen with multiple sclerosis.
Multiple sclerosis is diagnosed when people have certain symptoms such as numbness in the limbs, loss of vision, fatigue, and loss of balance. And all these symptoms corresponded to what Helen had.
Okay, the error in communication. The protective wrappings around the nerve cells in the brain and spinal cord are destroyed, so they can no longer transmit signals from one area of the brain to another. And the nerve damage caused by multiple sclerosis leads to many problems such as muscle weakness and blurred vision. And in the picture, the myelin sheath is damaged by the MS cell.
Okay, so there's no cure for the disease, but medications can slow the progression of the multiple sclerosis. Medications include interferon beta-1a, teriflunomide, and fingolimod. And steroids may also be used to decrease the severity of attacks.
Okay, the disease is not a fatal disease, but the average longevity in the population of patients with MS ranges from 25 to 35 years after the diagnosis, and the frequency of death by suicide is found to be 7.5 times higher among patients with MS. And the patients will need assistance in walking or will be wheelchair bound 15 years following the disease, so it will be difficult for them to do like regular everyday tasks.
And professionals that can help people with multiple sclerosis is an occupational therapist and neurologist. The occupational therapist helps people with everyday living, and they help them bathe or like change clothes. And then a neurologist, they treat symptoms, and they do like help with weakness, tremor, and like cognitive changes.